Massage and acupressure to prevent and treat lower limb arthritis and gout. Hello. Arthritis is a term used to describe a medical condition of the joints. People with this condition often endure discomfort due to swelling and pain in one or more joints in the body. The main signs of this condition include pain and stiffness, and it often gets worse over time. The most commonly affected joints are knees, hips, wrists, ankles and toes, etc. The choice of treatment varies depending on the specific type of inflammation, and regardless of the method, the goal is to relieve symptoms and improve the patient's overall quality of life. The exercise I present to you below is very effective in preventing and reducing pain and discomfort caused by arthritis of the lower extremities with many different causes, including the cause of gout. Please observe and practice with me. To practice this exercise effectively in treating diseases, you need to firmly understand the location and how to determine the location of the following 3 important acupuncture points. The Hoshi Acupoint, SI3. The Yangling Quan Acupoint, GB34. And the Weizhong Acupoint, BL40. You can easily review details about where and how to find these acupoints on this channel as well as on many Vokudo channels and websites. Now, we will practice on each acupressure point, in order from top to bottom and each side of the body, starting from the left or right side as you like. Here I will start with the right side, and if there are no problems, you can also start with the right acupoints like me for convenience. First of all, we will apply the Hoshi Acupoint on the right hand. This is my right hand. This is the Hoshi Acupoint on my right hand. The Hoshi Acupoint is the 3rd acupoint located on the small intestine meridian, located in a concave position right next to the posterior border of the 5th metacarpophalangeal joint. On the boundary between the skin of the palm and the skin of the back of the hand. You can review the location and how to find the Hoshi Acupoint in video SI3. There are many ways to press the Hoshi Acupoint, but here I mention a very simple and effective way to influence the Hoshi Acupoint, which can be practiced in many different positions such as standing, sitting or lying down. Specifically, you can use the tip of the index or middle finger of the left hand to press directly on the Hoshi Acupoint of the right hand like this. When pressing the Hoshi Acupoint, in addition to keeping your breath slow, deep and gentle along with relaxing your whole body like when pressing any other acupoint, you should relax both hands. Always relax your wrists, elbows, and shoulders. Note that the tip of the finger pressing here is always slightly upward, towards the metacarpophalangeal joint so that the tip of the finger always impacts the correct acupuncture point position. You need to pay attention to combining pressing and rotating your fingertips. Thereby you will also feel the location of the acupuncture point very clearly every time your fingertip presses the acupuncture point. The force of pressing and rotating acupuncture points is relatively strong within the pain threshold, related to your current medical condition. Continuous pressing and rotating the acupuncture point like this lasts about 3 to 5 minutes. According to Oriental medicine, the Hoshi Acupoint has the effect of activating meridians, clearing organs, eliminating heat, relieving pain, and soothing the mind. The Hoshi Acupoint is often prescribed to effectively treat many different diseases, from ear and throat diseases, neurological diseases, to diseases of the motor system, musculoskeletal system, and other diseases of muscles, tendons, etc. And especially the Hoshi acupoint is the first important acupoint in the 3 acupuncture points to treat pain caused by inflammation and swelling of lower limb joints: the Hoshi acupoint, the Yanglingquan acupoint, and the Weizhong acupoint, as in this exercise. After about 3 to 5 minutes of pressing and massaging the acupuncture point, before moving on to another acupoint, you can use the massage technique for the acupoint that was just pressed, gently rotating a fingertip on the acupoint like that, in a few tens of seconds. Now we will work on the second acupoint, which is the Yanglingquan acupoint, GB34. This is the Yanglingquan acupoint on my right leg. The Yanglingquan acupoint is the 34th acupoint located on the gallbladder meridian. The Yanglingquan acupoint is located in the depression below the outer surface of the knee joint, just below the head of the fibula. Here, this is the location of the Yanglingquan acupoint. It is located on the outside of the knee joint and right below the head of the fibula. You can review the location and how to find the Yanglingquan acupoint in video GB34. Regarding pressing the Yanglingquan acupoint, we also use the technique of pressing and rotating directly on the acupoint with one fingertip, such as the middle fingertip like this. You can use any hand you want. However, I like this method the most because it is relatively easy, takes less effort, and is very easy to control the pressure. You can follow. Here, this is the Yanglingquan acupoint on my right leg. We place the tip of the middle finger of our right hand on the acupoint. Then wrap our hand down to hug the entire front lower part of the knee. So our hand has tightly grasped below the knee, and so you will surely feel the acupressure force of the tip of the middle finger is much stronger, and at the same time it is very easy to adjust the pressure as desired. We press and rotate directly on the Yanglingquan acupoint like this. The pressing force is also relatively strong, produces positive feelings of pain, excitement, and stimulation. Depending on your medical condition and pain tolerance, you decide on the appropriate pressure and rotating. Continuously pressing and rotating like this also lasts 3 to 5 minutes. According to Oriental medicine, the Yanglingquan acupoint has the effect of relaxing tendons and muscles, expelling wind, and eliminating humidite and heat. The Yanglingquan acupoint is often prescribed to treat digestive diseases such as heartburn, cholecystitis, neurological conditions such as hemiplegia, intercostal neuralgia, back and thigh pain, etc. And especially the Yanglingquan acupoint is often combined with other acupoints to effectively treat lower limb arthritis. Now, before moving on to the next acupuncture point, don't forget to massage the acupoint like this for a while. Now, please join me in moving to pressing and rotating the third acupoint, which is the Weizhong acupoint, BL40. The Weizhong acupoint is the 40th acupoint located on the bladder meridian. You can also review related content in the BL40 video. To stimulate the Weizhong acupoint most effectively and with less effort, you can place your lower leg along with your right knee on the chair like this. Then, We use the tip of our right thumb to press directly on the Weizhong acupoint in this way. The force of pressing and rotating is also relatively strong, enough to cause pain within your pain tolerance. Continuously pressing and rotating like this also lasts 3 to 5 minutes. According to Oriental medicine, the Weizhong acupoint has the effect of clearing blood, releasing heat, eliminating wind, eliminating humidite, and relaxing tendons and muscles. The Weizhong acupoint is often prescribed to treat diseases ranging from sunstroke, low back pain, calf cramps, sciatica, lower limb paralysis, to inflammation and swelling of the lower limb joints, etc. And here in this exercise, the Weizhong acupoint is combined with the Hoshi acupoint and the Yanglingquan acupoint to have a very positive and effective treatment effect on pain caused by inflammation and swelling of the joints in the lower limbs, whether due to any cause, including gut causes. Now, before moving on to the next acupoint, don't forget to massage the Weizhong acupoint like this for a while. Thus, we have practiced affecting the 3 acupoints on the right side of the body in order from top to bottom: the Hoshi acupoint of the right hand, and the Yanglingquan acupoint, with the Weizhong acupoint on the right leg. And so, we have completed half of this exercise. Now we will continue to complete the remaining half of the exercise on the acupuncture points on the left side of the body, also in order from top to bottom: the Hoshi acupoint of the left hand, and the Yanglingquan acupoint with the Weizhong acupoint on the left leg. Also follow the pressing, rotating, and massage procedures for each acupuncture point, and also within the same pressing and rotating time of 3 to 5 minutes as above. You can practice this exercise at least once a day in your free time, preferably in the evening before going to bed. Wishing you good practice, little by little repelling diseases and reducing pain. Thank you. Goodbye and see you again.